Hi, my name is Richard, and I'm here to go over my SVN competency, and that's a small volume nebulizer. Before entering the patient's room, I will look over the patient's chart, look over the doctor's orders, past history, name, birth, date birth, and any other kind of information that might impact the treatment. So once I look over the chart, I would then gather the equipment. In this case, it would be the SVM, which is this device right over here. This is decided to use this device because the patient has slightly uh, poor hand-mouth coordination, so that would be easier for the patient to take his medication compared to MDI. I will also have some gloves, a peak flow meter, blood pressure cuffs, as well as pulse ox and hand sanitizer. So once I got everything gathered, I'll go ahead and knock on the door. Hi, my name is Richard. I am a student at Hartnell College Respiratory Care Program. I'm here to do a treatment for you. Hopefully that's okay. And may I have your name and date of birth, please?
Christian Gelvin, 5/25/1991.
Check on your wristband. All right, thank you, Christian. Is it okay to call you Christian? All right, Christian. So we're going to be doing what we call an SVN treatment. This is a small volume nebulizer. The medication is actually going to go into this little cup here, and the medication is a albuterol, and it's going to help with some tightness in your chest, and our chart showing that you have a bit of difficulty breathing right now. This will definitely help with that. This is attached to your to a gas source, which is right behind over there, and it'll basically aerosolize the medication and allow you to breathe with it. All right. Do you have any questions? It's not going to hurt. Just basically going to breathe in like you would normally do, and every fifth breath you're probably going to go ahead and do a deep breath that will allow the medication to get a little bit deeper into your lungs. All right. So first off, we're going to be doing your vitals, checking your heart rate, your blood pressure. Check your oxygen levels as well. So the medication does have a bit of a side effect to it. It may raise your heart rate a little bit, and it may cause you to feel a little jittery. Those are normal, and I'll be here for the whole treatment, so I don't exclude anything, and we'll be basically monitoring everything that's going to be happening. Okay. All right. So, if you don't mind, we're going to start to listen to your lungs. Would you mind if I just open you down a little bit to the side
Sure.
here? Just roll this up a little bit. So whenever you feel the stethoscope, just go ahead and take a deep breath in for me, okay? All right, thank you, Christian.
It's a little cold.
I'm sorry, let me warm that up for you. All right, let's try that again for you.
Thank you.
All right, we'll listen to your throat here. Okay. We'll also be listening to the back of your lungs. If you don't mind, just I can help you. If you can just roll over to the side. All right, thank you, Christian. Again, just each time you feel my stethoscope, just take a deep breath.
It's a little cold.
So sorry about that. Thank you, Christian. All right, so we're going to check your oxygen saturation, and also going to check your heart rate. Okay, just put this in your fingers here. If you don't mind, just put your hands across your chest right here. Thank you so much. Thank you, Christian. Do you mind if I keep that on there for you? All right, I appreciate it. So the patient's pulse ox reading is at 93. Counted 30 seconds. I got 40 beats per minute. 40 beats in 30 seconds. Multiplied by 2, I got 80. I checked his respiratory rate as well, and I counted 8. And again, in 30 seconds multiplied by 2, I got 16 breaths per minute. All right, Christian, I'm going to take your blood pressure. Okay. So if you can put it on this arm, or do you prefer a different arm?
No, it's
Just let me know if it's uncomfortable for any reason, okay? Do you mind if I just rest this over here? If you don't mind holding on? Check the pitching energy.
That's fine.
Thank you, Christian. I got 120 over 70. Is that about normal for you? Thank you, Christian. All right, I'm going to be doing what I call a peak flow meter. This will kind of measure how much air you can blow out at your maximum effort. And it's like blowing out a candle. So we're going to set this according to some of your stats. That's by your age and your height. And I got your chart, and it says you're 25, about 7 inches tall. So your goal is going to be 600. So set it right over here. And the idea is you would just wrap your lips around this guy right over here and just blow as hard as you can and try to get this meter as close to your goal as you can, okay? And we're going to do this 3 times, and we'll record your best results, okay? So go ahead and do this for me. So go ahead, take a deep breath in and blow as hard as you can. All right, good job. We're going to do it 2 more times, all right? Do it once again. Take a deep breath in, and then blow. All right, good job. All right, one more time, all right? Okay, go. Deep breath, and blow. All right, good job, Christian. So I got a reading of 500. It's very close. All right, and we're gonna go ahead and set up the device now, all right, for you? Oh, do you need to take a cough? Do you need to cough, anything like that?
Don't feel like it yet.
Okay, just let me know if you do. I'm gonna probably go ahead and do a cough for you afterwards. All right, so. So in this cup right over here, we're gonna pour in your medication.
Okay.
And when we do pour it in, we're not gonna touch the sides to contaminate the cup and the medication. So we're gonna pour that in there right over here. This treatment's gonna last about 5 to 15 minutes, and I'll be here for the entire time. All right. We're not actually gonna pour this in or turn on the device, but once we do turn on the device, get the air coming in. It's going to mist. It's going to mist from the front as well as the back. And you usually check before giving the SVN to the patient against a dark background, and you should have a white vapor. All right, Christian. So as I said, right over here, and you're basically just going to wrap your lips around over here. Let's hold it up about this angle right over here. It's kind of gravity dependent, so just make sure the medication. Just go ahead and breathe in normally. And every 5th breath, go ahead and just take 1 big breath. All right, Christian, doing great. I'm going to say it's been about 15 minutes. The device would start to sputter, and you can probably just go ahead and flick the cup a little bit. If there's any other kind of medications inside there, that'll kind of loosen it up and allow it to flow. All right, Christian, I think we're about done here. Thank you. How are you feeling? How are you breathing?
A little better. A little better.
That's good. So we normally set this to about 8 liters per minute. Turn it off. This would normally come in a bag. Sterilized bag, and this is for the patient. You would basically disassemble it and put it back in that bag, leave it in the patient's room just in case other kind of treatments is indicated down the line. We would essentially just rinse this and go ahead and do an air dry or use the oxygen to dry it off. So the device is basically made of a T-piece, the mouthpiece. We have the spacer where the excess mist is going to go. All right, so Christian, we're going to do your vitals once again, just to make sure everything is good. I'm going to listen to your lungs once more, all right? Thank you. All right, I'm going to do your side just to get it into listen, okay? Christian. So whenever you feel it, just go ahead and take a deep breath in. or like before, I'm gonna listen to the back of your lungs. If you don't mind rolling to your side, you need help.
Can you warm it up a little more?
Yes,
Sorry,
I can
it
do
was
that.
very cool.
Okay, thank you, Christian. All right, thank you, Christian. And I forgot one thing. Let me just go ahead and listen to your.
Sure.
Alright. Thank you, Christian. Alright, we're gonna check on your pulse once again, okay? In case you're hearing across your chest. Alright, thank you, Christian. Go ahead and take this from me. So I've got a counted his heart rate for 30 seconds, and I got 45. Multiplied by 2, got 90. Also counted his respiratory rate at 8. Again, multiplied by 2, I got 16. His pulse ox reading shows at 97, which is all in the normal range. And let's go ahead and do the blood pressure. I've got a lot of this today, right? All right, last one, I promise. Just don't notice the rest is against your chest here. Thank you so much. Oops. Okay, thank you, Christian. So I've got a blood pressure of 118/75, so that's still within the normal range there. All right, last thing we need to do, we're going to do another P flow. So we still got your setting there at 600. So just go ahead and blow as hard as you can. It's like blowing out a candle. We do this 3 times once a week, okay? So go ahead and take a deep breath in. Blow. All right, good job, man. Okay. 2 more times. Go ahead and take a deep breath in. All right, thank you. All right, one last one. Go ahead and take a deep breath in. Make it the best one. All right, great job. So I've got a reading of 600. It's very good. All right, so thank you for letting me do this for you today. Do you need anything? Do you need more pillows, more blankets, TV
No.
on, anything like that? Yeah? Just want to sleep? All right, that's good too. So you do have call buttons on either side. So right here and right over here. And there's going to be a tether with a call button as well. So if you feel uncomfortable, if you have any questions, call and ask for me, or a nurse will be able to help you as well, okay? All right, thank you for letting me assist you today. You can just call me if you need anything. All right. And when we exit the patient's room, that's when we go ahead and do the charts. Just note any abnormalities. The sounds, the pre-sound, lung sounds, had a little bit of crackle on the lower left lung, and the post I did feel that it's cleared up. It has a more clear. As for the peak flow, we do have a pre minus the post divided by the pre. And we're looking for a 20% increase. And I believe that is it. Thank you for listening.